This is the root Polygonum cuspidatum. For years it has been used in traditional Chinese medicine for good health in people suffering from depression. Western medicine was made use of this root, identifying the chemical structure resveratrol. To describe its uses, we have Professor Joseph Bauer.
Other than its antidepressant function, Polygonum cuspidatum has been used for a variety of applications in Chinese medicine. Most notable are its antiviral applications, with emphasis on hepatitis B. Outside this, it expresses significant results with tumours, diarrhea, and inflammation. As for its application to Western medicine, uses resveratrol, isolated from Polygonum cuspidatum, have turned out to be massive. Resveratrol is shown to decrease insulin resistance, decrease inflammatory marks, prevent atherosclerosis, increase blood flow, cancer reductions, and high rates of antioxidant activity. Most exciting of these is the potential use in diabetes and cardiovascular disease, where resveratrol has at high doses. Even more encouraging is the range of natural products that contain resveratrol. Recent studies have found that mainly grape skins and wine is also detected in peanuts and broccoli. However, these alone cannot be said to confer all the benefits of resveratrol.
The effects of resveratrol are best explained through its antioxidant activity. The A ring of resveratrol is capable of donating a hydrogen, not an electron, from the 4' hydroxyl to free radicals, nullifying their oxidative effect. This implies increased strength of resveratrol in biological systems, greater than that of vitamin C or E. This inherent strength as an antioxidant is passed on to metabolites, which maintain this hydrogen transferability at a greater affinity while maintaining its planar core structure. The antidepressant action of trans-resveratrol was analysed in 2 animal studies, both involving Dr. Z. On his behalf, here we now have Assistant Professor William Ogle.
In the pursuit of determining the antidepressant action of trans-resveratrol, a team and I conducted 2 studies measuring behavioural changes in rats under normal conditions and under chronic stress. Both studies revealed similar results, that the application of trans-resveratrol mimics the antidepressant action of conventional antidepressants, fluoxetine and empyramine, in repairing normal behaviour to depressed rats at high doses. Our sample rat showed significant recovery in both studies, which included a fall swimming test and a tail suspension test in the first study, and a shuttle box test and a sucrose preference test under chronic stress in the second. This is a very promising result for the first analysis of the antidepressant function of trans-resveratrol, and was supported by the simultaneous biochemical test performed on the sample rats. For the analysis of these tests on the 2 articles, I would love to present Dr. James O'Donnell.
Thank you, William. After the behavioural tests were administered, the subject rats were decapitated and the hippocampus, hypothalamus and frontal cortex analysed for changing levels of monoamines. In all samples of the rats on trans-resveratrol showed significant increase in monoamine levels, with particular emphasis on serotonin and norepinephrine. No increase was observed in dopamine in the analysis. While serotonin increased in all regions analysed, norepinephrine did not show a significant increase in the hippocampus of the treatment group. In order to match the effect of positive controls through the studies, a concentration of 80 mg per kilogram of trans-resveratrol was needed. This was significantly higher than the concentrations necessary for the conventional antidepressants, indicating that the efficiency of trans-resveratrol is less than that of drugs currently available in the market. In addition to our monoamine analysis, the activity of monoamine oxidase was measured in the same regions of the rat brains. The treatment with trans-resveratrol showed significant decrease in the activity of MAO-A, but not MAO-B. This is a very optimistic result for the treatment of depression without the occurrence of inconvenient side effects, as is seen with other MAOIs. We hypothesized that this was due to the antioxidant activity of trans-resveratrol. It did not inhibit the MAO enzyme so much as encourage regular functioning by removing oxidizing agents, allowing monoamine levels in the patient to stabilize normally. For this reason, we believe that trans-resveratrol shows significant potential for human trials and use in depression in the future.
The potential for use of resveratrol is immense and continues to expand as new groups like Dr. Z's discover new and exciting ways to apply this efficient and natural antioxidant. As for the potential of trans-resveratrol in the future treatment of depression, the literature is very supportive, despite very few studies having been done so far. In future, more animal studies will be conducted looking into long-term and possible side effects of trans-resveratrol. This area spans everything from cardiovascular health to neuroprotection, so it is safe to say that we will be hearing a lot more about resveratrol.